Hi guys, good morning. I haven't been making as many videos as I used to because the explanation I gave on my last video about filling up my phone, and I had to get a new phone, and I don't want to do that to this phone, so that's why it's been kind of sparse. But I did want to talk to you guys this morning and just fill you in, and maybe so you can be, more aware. In my 40s, I started to develop basal cell carcinomas, and I've had many, many surgeries, as other people have as well, for that problem. It's called the Mohs procedure, and they get all the cells and sew you up, and then you can leave, and it supposedly never comes back. And every time that I've been diagnosed with that, the doctor, the nurse, whoever gives me the results have said, well, it's just a basal cell. And the reason that they say that is because there's basically three types of skin cancer: basal, squamous, and melanoma. And it goes up however deadly they are, melanoma being the most deadly. Therefore, basal cell is usually not in, it doesn't infiltrate, it doesn't become systemic. And so they don't worry about it too much. They just kind of blow it off. And I wish they would stop doing that, because if you do, especially in your older years, have any kind of a red lesion, itchy, scabby, that, the scab comes off and it bleeds and it just scabs again, it just doesn't go away. Get it looked at. It may be just basal cell, but I don't think that any type of cancer diagnosis should be prefaced with the word just. When you get a cancer diagnosis, it changes your life, and I don't care if it is just a basal cell. So I went to the dermatologist last Friday, and I had a few spots, and I wanted her to, freeze them off. And she did. Here, you can probably see, and then down here, I've kind of got covered up with makeup. And then for a long time, I've had a scabby lesion on my scalp above my right ear. But that area has very little skin. It's mostly, just a layer of skin over bone, as you know, by the way we're made. And I just thought, I'll just have her continue to freeze it off. I don't want to have the surgery again. The last time I had surgery, I don't know if you're new here, but if you're not, you may recall it was quite traumatic for me, and I'm still pretty scarred up this eye and down here and my forehead. And since they kept describing it as just a basal cell, I thought, well, I'll just keep an eye on it, and I'll just have her freeze it with that stuff every time I go in, and we'll be good. Well, she froze these other spots, and then I said, can you just, freeze this too and kind of calm it down a little bit, because it's been bothering me. And she said, yeah, let me look at it. So she got out her little thing, and she got real close to it and everything. And she was looking at it for, a minute or two, and I thought, something not right. And she said that, hi, Lucy. She said that it didn't look like something that she was comfortable just freezing and then not seeing me for another 6 months. She said it looked like it had some blood vessels running through it or something. And it's a pretty large area, and she didn't want to just let it go by that. And she said, I want to do a biopsy of it. And I said, well, you can, but I'm not going to have surgery. And she goes, well, I still want to biopsy it. So we did, and I got the results last night, and it's not good. And because it was just a basal cell, I've let this thing go for a year or two. And at this point, she called it an invasive basal cell carcinoma. I know you all know the definition of invasive. It's gone inward. I guess in extreme cases, and I'm not saying that I am that, but I guess in extreme cases where it's not tended to, it can actually become systemic and end up inside, just like the other cancers can, if left untreated. And so here we are. I have an appointment with a surgeon. I don't have an appointment. She's sent over a referral. I will have an appointment. She said you can either set up the surgery, the first time you see him, or you can set up for a consult. And I have a lot of questions. So I'm going to set up for a consult first and go in and talk to him. I want to know, how extensive would this surgery be? With how's he going to suture it together when there's not any skin back there? Come here. Is it going to require skin graft? How deep has it gone? Do we need to do any other testing? I've got a whole list of, yeah. And my in-laws were over last evening, and when the phone call came in, and I'm not gonna lie, I kind of had a meltdown because I'm just tired of dealing with it. I'm tired of having surgeries on my head and my face, and resolved myself to the fact that it was just a basal cell, so I wasn't too worried about it for an extended length of time, and now here we are. So get your body checks done. They can find things and see things that maybe you can't sometimes a lot. They're on your back or something. If you don't have a partner that can check you, it's good to go get a body check by a dermatologist. So do that. And I guess wish me luck, wish me well. And it's like I told you in another video that I did about cancer, any kind of cancer. I told you when I had ovarian cancer that I just got swept up into the system, and the doctors, A, B, C, D, and E, and this is what you have to do in this order. And next thing I know, I'm got a port and I'm sitting in a chemo chair. And looking back on it, I probably would have had to do that anyway, but I would have had a pretty, appreciated a minute just to chew on it and feel like I made my own decision about it. So you can always say no. You can always have your own opinion and make your own choices. And those considerations would be, like scarring. Like, are you going to have to shave the side of my hair off after I've worked all this time to get it back? Are you, what's it going to entail? I'm going to be 68 in February. Do I want to do this? How deep does it go? There's a lot of consideration that I'm going to put into this decision before I just go in there, or make a decision, go in there and lay down on the table like I always have before. So I just wanted to catch you guys up on that. That's where I'm at now, yay. And, to reiterate, make sure you get your body checks done. And if you have a suspicious thing and anybody ever says, like it's probably just a basal cell, well, it's still cancer. So take it to heart. And if you overreact, like I think my husband thought I did last night, it's not his body, and he's not had these surgeries. And so it's me. It's about me. So whenever all this transpires and I get seen and everything, I may come on and let you guys know. Again, not so many videos because I don't want to fill up my phone. And that's all I have for you today. Have a great weekend, and thanks for watching.